go. Unbelievable.
You got it?
Yeah.
Cool.
And no error messages.
Okay.
Okay.
How about that? I like it.
Somebody at work got a email, and it said check. As you know, they've changed the policy for leave, and on January 1st, you'll be paid out any residual, PTO time. Click here, but it had a big banner at the top that said this is not originating from our employer.
Oh no.
And they clicked on it, and it said, you clicked on a phishing email.
Yeah.
Now
we
they have to
used
take a
get
class.
We used to get those.
Oh, you did?
And I always would mess up. They were hard.
Sucker.
Ours never said at the top that it wasn't.
Yeah.
Sucker.
It's funny. Okay.
Just FYI, I don't see us on streaming yet.
Yeah, I'm looking at it.
Okay. No, I'm just telling you.
Well, okay. Where are you looking? Because I'm looking at it. It says
On
that we are
YouTube.
streaming.
YouTube.
Okay, can you reset your browser or
Yep.
go out and come back in and see?
Resetting.
Because I'm seeing the things that says stream starting.
Resetting. All right, live stream.
You got it?
Yep.
Okay, we're good.
Let's do it.
Okay, all right.
There's
Shoot.
Sean. And Nana.
Richard Hindu Kush. Calling cards. Nada. Why do you say nothing?
Because Sean said, "Que pasa, amigos?" I said,
Oh,
"Nada."
okay. All right. Well, like I said, I'm not going to be like Stuttering John and read every single person that comes into this chat room. All right.
You kind of have other things you need to be doing. Like answering stupid questions about your stupid nuts.
Well, we have a shitload of questions today. We got like 15, so it's gonna. We'll do. You've got some stories, though,
I've got
right?
three good ones. Yeah.
Okay. All right. Here we go. Here comes the air conditioning.
Yes.
Sorry. All right. You ready?
Let's do it.
Okay, I'm recording on the wrong track. I'm an idiot. Let's try that again.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from
They
my
can't
nose.
hear it otherwise.
I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want to requiem.
Provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have in the studio my partner in crime, Tacey. Hello, Tacey.
Hello.
Actually, not a criminal, but that's just a turn of phrase, don't you know?
Feel like one today.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh head.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take anything you hear on the show with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor. nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Anything going on there?
A lot of sinus spray.
Yeah.
Lots of it, yeah. Pretty hot stuff right now.
Have you talked to anybody about maybe changing the delivery, the bottle in the future?
Not yet.
I loved the old bottle that you had.
Yeah.
I don't hate this one, but I love the other one better.
Mm.
Interesting.
Yeah, not a big difference. Just two different suppliers. That's
So
all I've done.
let me ask you something. So when you have something like this, because I'm always thinking about things I'd like
Bitching
to
about
maybe do.
things.
Yeah. No, I'm interested in how you bring something like this to market. Do they send you a bottle and you get to put your stuff in it and sample it to see how it works, or does it just show up one day and you go, "Oh fuck, this wasn't the same as the last one"?
Yeah, what you do obviously is get a bunch of samples in different bottles and kind of figure out which one you want.
Yeah,
and then pick
They
that,
do?
and then
Okay.
then you can buy because they'll sell them to you in bulk. I mean, big bulk.
So you pick this one. Now, one of the things is it'll last longer.
Yeah.
You don't need. Something happened.
No.
Hang on, something bad happened.
Oh my
Hold
god.
on.
Ooh.
Okay, so I don't know what happened there. Okay, just answer that. You ready? 3, 2, 1.
So it's they're all a little bit different, but what we try to do is have consistency. So you buy one and you pick the one you like, and then you buy a whole bunch of them.
Yeah,
and
yeah,
then
yeah.
you try to get to
They'll sell you as many.
yeah,
as you
they'll
want.
say about as many. But the problem is, Dr. Steve, is quite often they'll run out, and then you have to come to something similar, and then you get that's kind of what happened with this. So.
Well, no, it's not bad. I figured that you did it on purpose because you wanted to decrease maybe the delivery because now you've got more than just peppermint oil and buffered saline in there.
Right.
There's CBD in there, and it'll last longer.
It's spatial.
So you get more for your money this way.
I'd like to take credit for being that forward thinking, but no.
Someone on Reddit. Okay, you know what? We'll talk about that on the podcast.
Okay.
All right. People who know anything about the Reddits, some of our subreddits and our subreddit, turn over to the podcast. We'll talk about that there.
Gotcha.
I'm not sure the SiriusXM audience will be as interested in that. Fuck me. Let me just redo this. I shouldn't have brought it up. Yeah, okay.
Let's just go right into quick.
Yeah.
Let's just go right into a topic right after that.
Yeah, well, we'll
Yeah.
be all right.
Don't think
I got to get it right before the someone. Okay. All right. Well, anyway, we're having too much fun here. You had some questions, or no? Well, you had some articles.
a couple
right?
articles. Yeah.
Taste, what'd you bring?
I
today?
brought nothing.
Fair enough.
She
But
brought
I brought myself,
She
which I
brought
haven't
the
even
hammer.
been doing lately. So I am here.
That's true. Even when you were here, you weren't bringing yourself, but today you were here.
Well, there was a reason for that, wasn't there? Someone was here.
Well, I don't know.
I'm sure I was busy. It's
Yeah,
so
I'm sure.
busy.
I think she was busy being retired and
Yeah.
running down to the
So-
swimming
I feel
pool.
so
to-
sorry
yeah.
for her.
Just so busy.
Yes.
Anyway.
It's such a challenge, but so
She sounds like Louis C.K.'s daughter in the first season when she's just going, I'm
bored."
bored. I'm bored.
I'm not bored.
Yeah, that's good. If I were retired, I would never be bored.
no.
All right.
You would be insane. You would have 70,000 different projects going. At the
Yeah,
same
but
time.
I would actually get some of them done.
I'm not doing anything, but I'm not bored.
Yeah, right. Fair enough.
That's very good. And
That
you're-
sounds great. That sounds like a problem I'd like to have.
Great.
Rewatching Friends is,
Oh.
listen, if you haven't done it in a while, it's really pretty good. The Golden Girls, I forgot all about the Golden Girls.
Oh, my God.
Listen, Sicily, 19 whatever.
We're
The
gonna
thing
have
I
to-
like about it is that since she's doing this when I'm at work, I don't have to watch any of this stuff. I
That's
can just
very
watch
true.
Better Call Saul
And you can always watch Friends. It's on basically every channel
all day long.
all day long.
It's amazing. All right. Well, anyway.
the
Thank you, Dr. Scott.
That's awesome.
Well, apparently the guest camera's not working.
Oh.
Good.
Yeah.
Yeah.
All right, so let's get into this monkeypox thing. So I was reading the monkeypox is found to be evolving at a faster rate than expected.
Yeah, okay.
Oh.
So, let's talk about this for a minute.
'cause
Go
we're-
ahead.
Well, it was just
You
saying.
read your thing, and I've got some shit to say about this.
Yeah, so they found in Portugal that they think the monkeypox virus is evolving at an even faster rate than expected, and they published it. And I don't know how.
So what do they mean by evolving? It means that the DNA is changing.
Yeah, and it's a double-stranded DNA virus.
Yeah.
So I guess.
So what? So what are they saying? That they keep testing it and
they're finding mutations.
different ones
in it.
are mutated, but is that turned into anything? What are they saying?
No, they're not saying it changes anything at all. All they're saying that it's changing more rapidly than they thought, but it's not increasing, hospitalizations or increasing
Nothing.
nothing. No. So yeah.
So there are currently 306 cases in the United States. Now, when I did this last week, there were 200, so it's increased by a third since then.
Mm-hmm.
But you have these outliers, and so what I did, if you're interested at all in learning about how numbers can be used, go to our Patreon, and I did an analysis using arithmetic means and then geometric means because there's some outliers. There are 63 cases in New York as of the time that we are recording this. There are 66 cases in California, and then like Arizona 1, Colorado 7, Georgia 7. There's 27 in Florida, and North Carolina 2. Oregon's got 1 whole case. So when you look at the total number of patients in the United States that have this right now is 306. Now, I don't know if when they resolve, if they're falling off. This is CDC monkeypox. I don't know if this is cumulative or these are current active cases. So let me see. Total confirmed. So this is cumulative. So this isn't even how many people actually have it.
Right.
Because some of the people that had it in the beginning, it's just gone away. So, 306 divided by 350 million.
Not a lot.
Yeah, your chances are,
Pretty small.
what, 1 in a million? Is that right? Yeah, 1 in a million. So those are still pretty good odds. If I gave you those odds, you'd go to Vegas and bet the whole house.
Bet the farm.
So the fact that these are these clickbait titles,
Yeah.
maybe it means something. If it's mutating in a way that makes it more transmissible or more deadly, that's a problem.
That's
If
a
the
big
DNA is just changing, it's just basically fucking around trying to see what what combinations work for it.
Yeah. And they say clearly says here pass through close bodily contact, open lesions, and through our favorite fluids.
Yes.
Yeah, so you have to have
Excellent.
fluids.
Right.
Yeah.
Everyone take a drink.
Keep your fluids
That's
to
the-
yourself.
Weird medicine.
Toast.
No, the weird medicine bingo game
Yep.
is every time we say
Fluid.
fluids, and that counts too. You have to take a drink. All right.
Cool.
So yeah, and the thing is, and I don't have my spreadsheet in front of me, but if you take a geometric mean, it will be lower than the arithmetic mean. So what is the geometric mean? I'll give you. I went into this in depth in the Patreon, which I'm sure people are like, "Ooh, I can't wait to sign up for your Patreon to hear, have a math lesson." But it is still kind of interesting in that, let's say you're doing a survey of hospitals and you want to look at their length of stay. And you're going to reimburse them based on how low their length of stay is. So the lower, the better. And you have this hospital that has this one dude in there that's been there for 600 days. And then you have 20 people who have been there for 11 days. If you do the arithmetic mean for that, that person that's been there 600 days is going to really skew that arithmetic mean higher. And the arithmetic means where you just add up all those numbers and divide it by the number of patients that
Right.
you had.
Right.
and it's called, you know, skewing the curve. Or, you know, you always had somebody in your class that had, you know, everybody get a 20 on the test,
And good old Steve.
and then somebody
Makes
get
100.
110, and then
then,
they'd
yeah.
if they were grading on a curve, it would F everybody up.
Yeah.
Because the curve was now busted by this outlier. So if you do a geometric length of stay, what you would do is you would take that 600 and multiply it times the next one, you know, 11 times 10 to, you know, all the different days. And then you would take the root of that. So if you had 10 patients, you would take the 10th root of that. And when you do that, it corrects for these outliers, and you get
for
a number.
fuck's sake, Steve.
Oh, okay. Well, that's how you do it with this monkeypox thing.
Okay.
Is if you do the arithmetic mean, it's going to be higher. It's going to look scarier than if you do the proper test, which is the geometric mean. All right,
Right.
we'll move on. So monkeypox, not a big deal right now.
Not a
but
big.
We'll keep an eye on it.
Keep your fluids to yourself.
And don't clickbait these. You know, medical journalism is just, and scientific journalism is really, really bad. And they'll monkeypox is mutating at an alarming rate, and it's like, okay, so they check it, and the DNA on these different loci are just different. And that okay.
Yeah.
Does that translate into anything? That's what we want to know.
Right.
I don't give two shits if some drug lowers my cholesterol if it doesn't in turn decrease my risk of heart attack and stroke.
Exactly.
And there are drugs like that. There's one out there, and I'm not going to say it because I don't want them sending me a cease and desist. But there's one drug out there that will decrease your cholesterol pretty significantly, but it doesn't translate into decreased heart attacks and strokes. So who cares?
Right.
Nobody writes it anymore because of that.
No.
So, you know, I always used to tell the reps that would come to see me, and they loved me because of these kinds of statements, that, you know, I don't care if somebody came in here with a drug that would triple my cholesterol but would decrease my risk of heart attack and stroke, I'll write the hell out of it.
Sure.
Because cholesterol is an intermediate endpoint. The true endpoint is, does it improve this patient's
Disease,
quality of
right.
life, or does it improve their survival?
Yep.
You know, that's the thing. All right.
Exactly. All right. Ready
There's
for something
Tacey.
new?
Okay.
All right,
just a
Tacey.
blank
Tacey,
screen.
this one's specifically for you.
I should have
Okay.
checked that.
Let me
before we
turn
started.
this. That way we can.
No, no, no.
No.
So hair raising research. Are you ready for this?
Uh-huh.
Hair raising research. Salk scientists find surprising link between immune system and hair growth. So scientists have uncovered an unexpected molecular target, common treatment for alopecia.
Yes,
and
alopecia, aka hair loss.
hair loss, yep. And conditions but this specific alopecia is when your immune system attacks the hair follicles and causes them to fall out,
Well, that sounds like alopecia areata, which
is different, right?
Oh, that's different. That's an immune system.
No, that's what it is.
alopecia.
Yeah, but they didn't put that on here. They just said plain alopecia. But they're talking about the
Are they
immune system attacking. Yeah.
Okay, so they're not saying that in male pattern baldness.
No, they are not.
The immune system. They're talking about immune mediated alopecia. So you have alopecia areata, which is where you get these punched out. Matter of fact, we have a question about this coming up, where you have punched out lesions. They're described as coin-like. They're almost perfectly circular sometimes, and it'll just be there's no hair there. And then you'll have alopecia totalis, and that's when your whole head becomes loses its hair because of the immune system attacking the follicles. And then you'll have alopecia universalis, which I understand that the guy that played Victor Zsasz in on that show Gotham, but also played Noko Hank on Barry. I understand he has that. That's a good look on him.
You can also get, what do you call those things that I had hair extensions and pull them out, and that can cause
That's true.
big circular.
Yeah, and that's just because
bald
you're
holes.
yanking your hair
That's
out,
just
right?
because I did that. Yeah.
What is it?
What?
What is it?
Tic-de-la-rue?
Tictillomania?
Oh, trichotillomania.
Trichotillomania.
Right.
Yeah.
Trichotillomania, yep.
I only have that
where
when I have
people-
fake hair, and
Pull their hair out.
Trichotillomania where they will eat it too?
I don't know.
Let me
I thought it
let
was
me
just
double
you
check
pulled
that.
it out.
Yeah.
I didn't eat it. Let's make that clear.
Well, while I'm
just-
looking this up, go ahead and
You
go
just
on.
saved it in your back pocket
Actually,
there for
I
later
put
use.
it. I did try to save it so they could put it back in, and I pull it out
Okay,
again.
now, so trichotillomania is just a compulsive desire to pull out one's hair.
Right.
Eating, I'm going to put in eating, and that's, okay. That's trichotillomania with trichorhizophagia.
Ooh.
So trichorhizophagia or trichorhizophagia, that's where you pull out your hair and then you eat it.
Okay.
Yeah.
That's
Then
crazy.
you get a hairball, which is called a bezoar,
Ooh.
and then you may get a bowel obstruction from that because you can't digest it. But anyway, go ahead.
Because then there's
So
no
you're talking
fluid.
about immune-mediated alopecia.
Yeah.
Because right now, if you have just in a couple of places, we'll do topical anti-immune stuff. It could be topical steroids. There are other medications that we can use. So go
especially
ahead.
if it's on the head or
Yep,
something.
go ahead.
So so these scientists did not begin by studying hair loss. They were interested in researching the roles of regulatory T cells and glucocorticoid hormones in autoimmune disorders.
Okay.
They first investigated how these immune components functioned in multiple sclerosis, Crohn's, and asthma.
God damn,
I
this is
know,
about
I
as
know.
boring as sex with my
Whole
wife.
show.
Go ahead.
We'll pick things up in a minute, Daisy, I promise.
Will we?
No, I'm interested in this.
But what they found was that these people that had issues with their immune systems, they were attacking
Yeah.
the
Yes.
the.
We established that. So now what are they going to do about it?
Well, I'm reading to the bottom of it. Let's get to the bottom. You didn't tell me to get to the conclusion part. I only
Show
read the
prep.
first.
It's the best show prep in the business.
I only read the first paragraph.
Well, at least everybody knows what trichotillomania
That's right.
is.
This study revealed regulatory T cells and glucocorticoid hormones are not just immunosuppressants, but also have a regenerative function.
Oh, so what are they going to do about it? They can turn it around, in other words?
Which is what they're trying to do is isolate those regulatory T cells and
now-
flip them, and that way it doesn't attack the
Now
the
you
hair
found
follicle.
some. So they found a target
Yeah.
to reverse things like alopecia areata, or maybe in these cases, alopecia universalis or totalis, because those you can't just inject your whole body
No, or
with
rub that
steroids.
stuff all over. No.
And so if you can turn the T cells that are killing the follicles and go, hey, stop doing that, and maybe promote hair growth, that would be awesome.
You know, it's been many years since seeing that, but I think the two cases I've ever seen that were profoundly stressed out people.
Yep.
And I think the stress levels increase their autoimmune
Oh,
disorder.
I'm sure
possibly.
that's
Yeah,
true.
yeah.
Stress is
And
bad
I mean,
for you.
hairless, top to
Yeah.
bottom.
Stress sucks.
Stress sucks.
Yeah, speaking of stress, I have to go get a fucking CT scan on my chest tomorrow. I had during COVID, I had that horrible cough that lasted 6 weeks, and so my primary care, real nice guy, got a chest X-ray on me, and back then it showed this sort of hazy place. Well, now he calls me, so the good news is listen. Physicians don't ever say good news, bad news. No one wants to hear that shit.
No.
He said, the hazy place is completely resolved, but now they're seeing some sort of scarring in there, and so now I got to get a CT scan tomorrow, 2 days before I go on vacation, to determine whether it's just scarring from the COVID-19, which is 99%. I'm sure that's what it is. Or is it pulmonary fibrosis from my stupid ozone generator or some genetic thing? So, I could either have a really good vacation or a really shitty one. But I'm going to have that tomorrow. So anyway, it's stressing everybody out. It's stressing Tacey out more than me, because without me, Tacey has difficulty, working the Alexa or you've got the TV worked out.
That's the only reason is Alexa.
And she'll starve to death because I do all my
And I would starve to death.
So anyway, well, I think it'll be hilarious if it was my ozone generator that did it.
Yeah.
Because
Ha 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 ha.
it's I'll be laughing about that. But anyway.
No, I won't be.
But I'm just hoping for post-COVID scarring. That's all it is. So
Yeah, I think it is.
Anyway, I had a bad case. If it weren't for the monoclonal antibodies, it would have been 1,000 times worse. And we've had PA or NP Mel B in here. She had it and has an autoimmune problem. She's talked about it.
Yeah.
Didn't get the monoclonal antibodies. They didn't even send her to get them until it was too late. When she went in, her oxygen was like 88%. So she ended up, here I am, 65, and at risk because of my age and my my mild to moderate blood pressure, and got it on day 2, and I was fine. And she actually had an autoimmune disorder, never got the monoclonal antibodies, and ended up on oxygen for 6 to 8 weeks at work. I mean, she was working with oxygen.
Oh, wow.
Yeah. So
that
pissed me off.
Yeah, I didn't see her in there.
That pissed me off to the point that she and I made a video about monoclonal antibodies that we were going to, put out there region wide, just to educate people on, hey, you need to be ordering this stuff because it's available. And then, of course, Omicron happened, and it was resistant to all of the old monoclonals that we had been talking about. And then that Sotruvimab, we could hardly ever get it, so we just said F it, and that video never came out. Pain in the ass.
No bueno.
Yeah, stupid virus.
That sucks.
All right, what else you got? Anything else?
Well, I've got one more on a keto diet, and I've also got
a keto diet.
I've also got a couple good questions in the chat room as well.
Okay,
so.
yeah.
Oh, real quick.
You mean in the waiting room?
Waiting room.
Oh my!
I'm not booing the waiting room. I'm
goodness.
booing the idea that we have a name for it, and it's the waiting room.
I said, I get one boo, but I don't get any bills.
That wasn't you. That wasn't for you.
I'm going backwards.
That's for me naming the YouTube chat room the waiting room.
Oh my word!
No.
Okay.
Hey, one more quick story.
Sure.
Yeah, scientists at Stanford University found that the ketogenic diet may help us live longer, and here's how. The diet.
I'm going to say this already.
Yeah.
I'm a fan of the ketogenic diet.
I'm 3 sentences in, so bear.
Oh my God! Could you
the diet
just read one of these things before you come in?
No chance.
Okay.
If you send them to me, I could maybe
Really?
read them.
Okay.
Oh yes.
Maybe I will alternate.
We'll make Tasty do it.
No, I'm not coming
Tasty
up
can
with
do
the
it.
articles, but
No,
I can
I'll send them to
read
you.
them.
Yep.
Tasty can do it. So really quickly,
Stacy's sending us a bunch of them, and I'll send you some of them.
Good.
I'll alternate.
Yeah, he always has some good ones. But so what it does is this keto diet makes muscle stem cells better able to handle stress. Similar effects have been found with a fasting diet. So what they're saying is the use of a ketogenic diet or intermittent fasting.
Well, I do both.
Yeah, have been shown.
I never eat all day long,
to take
and then
stress.
I eat ketogenic.
Maybe
at
that's
night.
why you've been so much nicer and more patient recently.
Who? What?
Yes, maybe that's.
Steve?
So anyway, it all boils down to diet, and I don't mean diet as in weight loss. I mean diet as in paying attention to what you eat. Yeah.
Well, we truly are
Shit
what
in,
we eat.
Shit out.
That's true.
Good stuff in, good stuff out.
I mean,
so, for the most part.
I get. It's no question that we are what we eat in
Right.
the sense that if our nutrients that we bring in. I mean, I'll get these naturopaths and you allopaths never talk about diet. And we talk about it all the time. That eating a proper diet that's got variety in it and has good nutrients, and yeah, you could blow it out your ass every once in a while.
Sure.
And eat a whole cheesecake. I don't have a problem with that. I've always said everything in moderation, including everything in moderation. In other words, you got to just blow it out your ass sometimes. And I think that is, it's ridiculous to think otherwise. Now, if there were one diet that we demonstrated works better than any other, we would all be on it. Now, we maybe have shown that with the vegan diet, but people just don't want to do that. So there is some really good data on vegan diet and health But I've also known a bunch of fat vegans too, who just ate a bunch of pasta and stuff all the time. Go ahead, Tace.
My provider says if Jesus couldn't eat it, you shouldn't eat it.
Okay, meaning
If
that he
it
couldn't
wasn't
eat
around,
cheeseburgers.
yeah, if it wasn't around when he was around,
Yeah.
then
And if you don't want to throw the religious bent, if Fred Flintstone couldn't eat it, you can't eat it. So that's sort of the paleo idea, that our ancestors did not have processed carbohydrates, highly concentrated carbohydrates. Our really remote ancestors were hunter-gatherers, so their diet was high in lean protein, and they'd have some carbs every once in a while if there were berries or if they'd eat the seeds off of grass or something, which was the precursor to flour. Really wasn't until agriculture happened that we started really eating things that had concentrated carbohydrates in them. And even then, we didn't eat that much. If you look back, and we used to talk about this all the time on the show, if you look back at images from crowds from the 20s, 30s, 40s, even through the 50s, you don't see nearly as much obesity as if you look at a crowd now.
Right.
And we've always said correlation is not the same thing as causation. But one of the things that did happen was we radically changed our diet when the USDA decided we need to make this pyramid and the bottom needs to be whole, grains, because they wanted to sell more grains.
Right.
So they started encouraging people to eat more bread and more grains and rice and flour products, and then we started eating crackers and cakes and cooking. And now sugar comes into the mix, and then the next thing you know, we're a nation of fatsos.
Fatsos.
And I include myself in that, so I
Me
can say
too.
that.
Me three.
Yeah. All right.
Good stuff.
Anyway, yeah. So I'm cool with ketogenic diet if it's done right.
Yeah, if it's done correctly.
That's not just the steak and bacon and mayonnaise and vodka diet. And that's what your Uncle Joe told you. And he heard that from his buddy, Cletus from the Holler or something. The true ketogenic diet, at least the way Adkins promoted it, was green leafy vegetables with lean animal protein.
Right.
And there's no way that you can't tell me having a grilled chicken salad for lunch with some vinaigrette on it is in any way unhealthy.
Right.
Unless they're putting sodium metabisulfite on the greens to keep them green. That pisses me
Then
off.
you'll shit your pants.
Just go, or you'll have abdominal pain.
Yeah.
Restaurants, just go to the market every morning and buy fresh greens and make your salads out of that. Goodness gracious.
I hear you.
All right. Good.
All right, cool.
That it?
That's it.
All right. Tacey, you got anything?
nope.
For one thing, don't take advice from some asshole on the radio.
So you got some questions from the waiting room?
Yeah, a couple good questions.
Okay. Well, I'll be the judge of that. And a judge of a good question is whether I can answer it without having to look something up.
Hey, so Kim Chickens wants to know about stem cell injections for knees and delaying total knee replacement surgery. What do doctors think?
Well, what do you think about it?
I think it's about like everything else. For a lot of people, it's very beneficial, and I can tell you that the guys that I work with that do these every single day, it all depends on if there's some structural integrity inside the knee that they can work with.
Yeah.
The younger the person,
That's right.
the younger the person, the better. Number one. The older the person doesn't mean you won't do as well, but what they'll do a lot of times is not use that person's stem cells. They'll actually get stem cells from a donor.
Yep.
Because the older you are, the less viable your stem cells are. And then finally,
Less viable everything is.
yeah, it's true. And then finally, what they have shown, acupuncture on the joint, specifically the knee, greatly increases the efficacy of stem cell.
What?
It does,
Okay,
yeah,
bring
because of
that
blood
study
flow.
up.
Yeah,
Bring
I'll
that.
bring
I
it.
want to see it.
Yeah.
I don't.
That is a true
I actually
story.
don't doubt it. I just want to make sure that we're.
You
talking
think I
about
would
something.
lie to
No,
all
no,
of
no,
the
no,
people?
no. Listen, when I write stuff in a chart, I always put citations by it so that I bring my receipts. We just need to bring our receipts because that is an interesting finding.
Yeah.
And if I could see that study. But okay, so to Kim's question, I found this is from the British Journal of Sports Medicine. It's one of the British medical journals. It's a BMJ journal, so it's not some shitty fly-by-night journal that you, well, anyway, let me leave it at that. It's called Autologous Stem Cell Therapy. So this will be autologous stem cells, or those that are derived from the patient's own body. In knee osteoarthritis, this is a systematic review of randomized controlled trials. So I'm going to give them one of these on that, because this is the kind of study where you can get some real information, where they take a bunch of smaller studies and do a very systematic review of all the data, mush it together, and then make a conclusion from it. And so they said stem cell therapy is increasingly used for knee osteoarthritis. We aim to review the evidence of autologous mesenchymal stem cell therapy on pain, function, and severity. And so let me tell you about the mesenchymal cells. So what they got, therapy derived from bone marrow, fat tissue, or peripheral blood. And after 1 year, clinical outcome measures improved compared with the controls. And in the stem cell group, patients improved by 1.8 to 4.4 points on the visual analog scale. So that's where you just say, where's your pain on a scale of 1 to 10? Mm-hmm. And with 10 being, I am literally sawing your leg off with a rusty saw in the, on the battlefield, and, during the war against this, war between the states. And I can't imagine what that pain must have been like. No. So that's a 10. And 1 is I'm tickling your foot with a feather. So where is it? So they improved by anywhere from 2 to 4 points, which is a big deal. That's like from going from a 7 to a 3. So 7 starting to get into severe pain, 3 being mild pain. And 18 to 32 points on this knee osteoarthritis outcome score. And that goes from 0 to 100. So on a scale of 1 to 10, that'd be, 2 to 3 points. 4 studies showed better disease severity on imaging after control at 1 year. And 10 of the randomized controlled trials out of the 14 were at high risk for bias on all outcomes. So they have to correct for that. But they found a positive effect of autologous mesenchymal stem cell therapy compared with controlled treatments on patient-reported outcome measures and disease severity. But the certainty of this evidence is low to very low. So they have a positive outcome across the board, but none of these studies were good enough to say, yes, we can say this is with high confidence. Mm-hmm. But still, probably worth doing, because all of the studies had a positive outcome. So. Yeah. And we need better studies than this. Mm-hmm, mm-hmm. But I love how they put this together. This is exactly the right way to do a study where you're compiling data from multiple studies. So, yep. And they came up with a conclusion that's supported by the evidence.
Cool.
So there you go. So the answer I would give after just reading that one article is that, yeah, I think that there's something there, and the data is generally positive, but we don't have that stunning, perfect, double-blind, placebo-controlled study that says this is what the outcome is. Mm-hmm. Okay?
Sure.
All right. Good one.
Good one.
What else you got?
Thank you. Colin Carnes, hey, Dr. Steve, do y'all have any suggestions for conventional and holistic treatments, including lifestyle changes for lupus?
For lupus.
Yep.
Okay.
Yep.
Go ahead.
That's a good question.
Yeah.
So, we see a lot of folks with lupus, and certainly the side effects of lupus. And one of the things we work with in the very first thing we do is go through stressors, and that can be exogenous stressors, lifestyle stressors, and certainly food stressors.
Yeah, stress is a real stressor when it comes to lupus, for sure.
And typically we'll work with whomever the folks' primary providers are, in case they do need medications when they have flares, like if they need a steroid or something like that, just to help kind of suppress the immune response. So the first thing I say anytime we see anybody with lupus is we've got to get the stress under control.
And one thing I'll say about Dr. Scott and what they do in his acupuncture suite, and I'm sure this is true about everywhere. Tacey, have you ever had treatments from Scott?
Yes.
So talk a little bit about how that went down.
It was amazing. Well, I mean, you did a TENS unit,
Yep,
right?
TENS unit, yep, needles
Yeah.
and electricity.
But talk
Yep.
about the environment and all that stuff.
Oh, it was very peaceful. You turned the lights down, and I didn't want it to end.
Wafting some music through the air.
Yeah,
Yeah.
it was really really nice.
A
Yeah.
certain kind of aromatherapy that might have
Yeah,
been
it-
enhanced.
Yeah,
with-
so it smells good in there. It sounds
No.
good in there. It's dark.
Yep.
You just get this intense feeling of relaxation when you're in there. And that, even if, let's just say that the putting of the needles was completely bogus, which we have demonstrated on this show. If people go back, or we can talk about it again, that for the right condition, it's not bogus.
Right.
And I am an empiricist, so I'm talking about data that's in the medical literature. That even if that were bogus, there's real benefit from that intense relaxation that you get, even if it's just for 30 minutes.
Agreed. In the environment, yeah.
Yeah.
And the placebo effect is a huge part of what we all do, you know. And I make it that environment for a reason. I tell don't rush to get to me. Don't get a speeding ticket.
Right,
because
right. Because
then
then
they're
you're
all
stressed
wild
out when they get
yeah,
there.
It's like, come on, man. And Dr. Steve, you know me. I keep that environment as much for my sanity as for my patient's sanity.
Sure.
too. So
Yeah.
I keep it very calm.
Well, you don't want your provider to be stressed out either, and that is a problem in
No,
modern
it's terrible.
medicine.
Terrible. It is. It's a huge, and a lot of the people that you and I both work.
I'm good at
With our
hiding
end.
it with my
Our end.
patients, but it is.
So when it comes to your buddies, we all know we kind of help each other out, and that's.
Yeah.
I have a lot of us that we work with every day.
So that's a
stress.
big one. Now, back in the day, we used to use hydroxychloroquine. Ooh, we're gonna get our channel
Hey,
taken
just
down
don't-
again
don't
because
use
I
any
said
other words while you're
Right, I will
talking
not
about
say
the H word. Don't use anything else.
Yeah. So they use hydroxychloroquine, systemic glucocorticoids, and some conventional immunosuppressive drugs. But now we've sort of moved to biologic agents, and there's this Belum. Oh God, I hate these monoclonal antibody names. As belimumab. Say that 5 times real fast.
No thanks.
Belimumab.
Belimumab.
Your mouth doesn't want to move that way. But anyway, and there are some new therapies targeting interferon, cytokines, which are the chemicals that are released by white blood cells when they want to kill something, and when they go after your own body, that's a problem. So we can target those things. We can target the receptors for the cytokines. There's all kinds of intracellular signaling where we can tell them to shut up and leave these cells alone. There's shutting down the cells that make certain antibodies or certain types of T cells that target only the cells that we don't want them to target. So there's a lot of activity in rheumatology these days, and your job, if you have lupus, is just to kick the can as far down the road as you can, because they are literally coming out with new stuff every day.
Every day, yep.
And I say that to cancer patients too. I use those exact words. Just kick the can as far down the road as you can. Go to a rheumatologist to get this treated. And if you have to go to a university center, that's fine. If you're interested in doing a clinical trial, go to clinicaltrials.gov and just look. There's 1 million studies for lupus right now. Because they're and not just lupus, other rheumatologic diseases as well. So we're going to solve it. We will hit Star Trek level medicine at some point. That may still be 100 years away. I always said that about
Lord, I know what the way things are going now.
But you remember when I first talked on this show about the lady that had stage 4 cervical cancer, and they took her T cells out and they exposed it to the tumor in a test tube, and then treated the tumor with chemicals to open up the proteins, and then sent those T cells back into her body and just to see what would happen. And she is walking around this world cancer free right now. Right? That was how many years ago? 2, 3, 4 years ago we talked about that, and we're like, this is going to be something. Well, I have several patients that are now getting exactly that. It has now been branded and patented, and it's called CAR T cell therapy, and it's chimeric antigen receptor T cell therapy. And what they do is they get your own T cells to fight your cancer, and it's not indicated for every cancer yet, but that's coming. And there are people, you can get this now. It's not even a clinical trial anymore. It's on the market. So that's incredible. If you're interested in those kinds of things, there are still studies going on. So you can go to clinicaltrials.gov, and there are B-cell targeted therapies. There's all kinds of stuff going on. This has triggered a real excitement in people who treat and do research on cancer therapies. And this is coming to pass. It's coming to pass 95 years quicker than I thought it would.
Right on.
You know, so
That's pretty amazing.
bravo to those guys.
That's wonderful.
All right. Anything else
Yeah.
from there?
Got
Yeah.
one from Diesel Child. Great question from Diesel Child. Dr. Steve, I'm about to have surgery on my hiatal hernia at the end of July. What can I expect for recovery times? I'm a skateboarder, surfer. I walk, I sprint in hills every day. So, he's obviously a pretty healthy dude. But talking about a hiatal hernia surgery, a fundoplication.
I'm assuming you're having a fundoplication
Yeah.
now. They do just do a hiatal hernia surgery where they tack down. So let's talk about what a hiatal hernia is first.
Sure.
So the esophagus passes from the upper pharynx, oropharynx, where you swallow, down to the stomach, right? And then, but the diaphragm is in there. The diaphragm's got to be there to provide downward pressure to expand the lung cavity so you breathe in. Right. Well, how in the hell does the esophagus hook up to the stomach when you got the diaphragm in the way? Well, obviously there's a hole in the diaphragm, and we call that the hiatus. And it's not a great design. It'll be one of the things when we're sitting in front of our creator, and if there's a Q&A, I'll ask, why did you design that way? Because it really caused lots of people a lot of problems. But it is a place where that area can become loose, and now the esophagus can pull up and actually pull part of the stomach up above the diaphragm. And that's called a hiatal hernia. So a hernia is any time a structure passes through a hole that it's not supposed to pass through. Okay. So inguinal hernia goes through the groin and passes through those rings. If you have a indirect hernia, where the vas deferens is supposed to go through. So the intestines aren't supposed to go through there, but when they do, we call it a hernia. And this is also a hernia because now the stomach is blooping up above the hiatus. Therefore, it's a hiatal hernia. So this is a major surgery it depends on how they're doing it. So if they're going to do a fundoplication, they can do that with a laparoscope now. But if they're going to do the open hiatal hernia repair, that can take 10 to 12 weeks. And normally, you can resume your normal activities before then, and as soon as you're off the opioids, you can drive and do things like that. They just mean don't be doing contact sports.
Right.
And it really takes about 12 weeks for a scar to fully heal and be done, and then that's what you've got. So it takes some time. Yeah. But anywhere, and really, again, it depends on the method that they're going to use. All right.
Good stuff.
Yeah, but I've thought about getting that Nissen fundoplication, and basically what they do is they just wrap the stomach around the esophagus and tack it down, and then it can't move anymore, and it helps to tighten that lower esophageal sphincter to keep acid and stomach contents from moving way back up into the esophagus again. Tacey had that the other night.
Helps with the burning,
right?
He
had mechanical.
Yeah, that's terrible.
But it doesn't. But people still have to take PPIs if they have a fundoplication. I'm thinking. I don't know about that, but what was wrong with you?
You got me on that. Now, sometimes if you have a Nissen, you may have to take a liquid diet for 3 weeks.
Yeah, because it can get tight.
Yeah.
Right.
The strictures. Yeah.
And then
spasms.
can
And
you
no
ex-
carbonated beverages for 3 weeks because you won't be able to belch and you'll just be farting and have huge abdominal pain. But talk about when you had mechanical reflux.
So, I mean, that happened to me when I was at the beach too. You just wake up and the acid is literally in your mouth,
yeah, it's pooling.
and it's
Awful.
so disgusting and so awful, and you just want to throw it up, but that doesn't help because it's just the acid.
When it
it's
gets in
just
your
like-
lungs too, because it's hanging around
and
where
you're
your
coughing.
trachea is, and
yes,
yeah, it's
it's
awful.
terrible. But why do they call that mechanical GERD instead of just regular GERD?
Well, you're having mechanical reflux in the sense that it is it's a mechanical problem. When you lay down, now your stomach and your esophagus are flat, and if that mechanical barrier, which is the lower esophageal stricture, it's a ring of muscle at the bottom of the esophagus. If it just opens up because you've been drinking
No.
or whatever, I'm just saying, not you, of course.
Hypothetically.
Right? Anybody else? Not you.
Stop bullshitting.
Oh yeah. Okay. So she's talking to you, Tace. But if for whatever reason it opens up, that's a mechanical problem, and all that because you're supine now. In other words, you're laying down flat. You're horizontal. There's no impediment. Gravity isn't holding the fluid in your stomach anymore.
terrible.
It just flows right up along the path of least resistance.
I was going through my friend's cabinets just looking for Pepsid, just because I had nothing
Yeah.
with me. I had a
Oh, it's
PPI with
awful.
me, but that wasn't
Just
going to do
remember,
anything.
first look in the refrigerator
Mouse
for some
turd.
mustard.
If I could have called you, but it was like 4 in the
No,
morning.
don't call me.
She doesn't listen.
No.
I wasn't even that. Yeah.
Yeah. a shot of mustard would have been okay.
Yeah.
Because I'm sure that would have been easier
Or
to
in
find.
the herb cabinet, a little bit of powdered ginger. You can put a little powdered ginger in
Really?
the water. Yeah, that'll calm it down some.
Really?
Oh, yeah.
No, thank
Yes.
you.
The
Oh, yeah.
mustard would have taken the taste away
yeah,
too.
totally.
Yeah. Then it would
'Cause
just taste
that's-
like a hot dog.
Oh,
Ballpark
that's just
crank.
awful.
Mm-hmm.
Them's are awful good. All right. You ready for some questions?
Sure.
Okay.
Yeah.
Let's see. We got this one. I think this one.
G'day, Mr. Steve
Good day.
and friends. I got a question for you.
Okay.
I lost it there at the end. Anyway, my old lady.
Oh, he fooled me. Okay, I thought, oh gosh, we've got a listener and
is having a
From down
problem,
under.
an ongoing problem for the last year plus, I'd say, with her hair, her scalp. She let me take a quick video. It shows her patchy hair. She's losing a lot of her hair. It was worse. It's kind of going ebbs and flows. There's no real redness, irritation, no dandruff, no bugs, nothing like that. There are some couple
okay, I want everybody in the waiting room to tell us what this is because you know the
centimeter in
answer.
diameter lesions or sores or pustules. Looked like she got shot with a BB gun right in her head. I promise I didn't do it. But shit, we can't figure it out. First thought it was maybe a yeast thing, candida,
Nope.
whatever growth. She complains
good-
about
Good thought.
maybe an oil secretion, like an overactive oil. She says that her hair feels oily a lot in the glands or her head, her crown chakra, all things that she said.
Okay.
Says that it's like clumping under her skin, like the
Could it be her crown chakra, Mr.?
Her crown chakra, if it were that clogged up, she would be having some other issue.
Okay.
hair can't
yeah.
burst out. It's odd.
That's what I thought too.
I don't know. She had once said that there were feeling as if there was some sort of subcutaneous worm. or
Oh
something.
no, that's a different situation. But
So it's pooling under her hair, under her
well,
skin. Like
she's
it
feeling
feels
that. I
like?
think it's the inflammation from the. Did
Oh.
anybody get the answer right?
Let me see here.
Well,
Not
okay,
yet.
we're so delayed that they're
Yeah.
probably just now answering it. But this is most likely alopecia areata. She's got small areas of patchy, circular. It looks like a BB gun hit her. Those patches are very small now, but they could get bigger. They could become confluent. She needs to see a dermatologist right now and get that looked at. Now, that wormy feeling, that could be another thing. But if you just feel it and you don't see them, that's probably a sign of inflammation under the skin that may be causing this. I've never heard people complaining about feeling in the inflammation when they have alopecia areata, but I wonder if it happens beforehand, and then it goes away, and then the hair follicles die, and then the hair falls out. So they may not associate the two things. So she may just be catching this really early, which means that they can treat it pretty quickly. I would be interested in whatever a dermatologist said. There are other things that it could be, obviously. Now, if you have someone that says, I have little filaments of stuff that I pick out of my skin, and they've got these lesions, and they're all over the place, anywhere that they can reach, but nowhere where they can't. That is a thing called Morgellons disease, and it is considered a psychiatric disorder. But you can treat it with typical things that would decrease itching, and one of those is a thing called doxepin. And doxepin is also an antidepressant. So it's hard to know whether it's decreasing the itching or if it is taking care of an anxiety type syndrome or a depression type syndrome. You can't tease the two things apart.
I really wish they could fix the losing hair thing. I hope that what we talked about earlier, because it just is devastating to women. And I mean, I know it's hard on men too, but man, for that to happen to a woman, I mean,
yeah. Well, if you have regular female pattern baldness in a male pattern baldness in a woman, hair loss at the top or it's thinning, you can use Rogaine. Women can use Rogaine. You could buy a 6-month supply from Amazon at stuff.drsteve.com for like $39 and try it, and it never hurts to try it.
Yeah.
A third of people have an outstanding result. A third of people have a satisfactory result, and then the other third really just don't get much benefit from it at all. But of course, check with your healthcare professional. We've got about 10 seconds to go. Were you going to say something?
No.
Oh, okay.
I didn't have anything to say either.
No. Well, thanks to everyone at SiriusXM whose steadfast support of this show has sustained us over the years. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Listen to our podcast at riotcast.com or wherever podcasts are found. That is incorrect. I got to do that over. That's not right anymore.
And we got to talk about Love Island UK. And
Yeah, we
just
will. We'll do
remind
that on the
people that-
podcast. Yeah.
Okay.
Okay, hang on. Listen to our podcast wherever podcasts are found. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Tace. Thanks, Scott.
Thank you.
Thank you.
All right. Very good. I just got to join this whole thing together. It'll just take a second.
Cool.
Anybody have any requests in the room for songs today that we can botch?
That we can butcher. Not
Scott
yet.
and I did a recording, and I put it on our Patreon. Only because I'm worried that if I put it on here, what'll happen?
Oh, yeah. Get dinged.
Well, maybe. I mean, it's really a Jimmy Cliff song. It's not a
Right.
Grateful Dead song.
No. Correct. That is
But
correct.
we did it for Love It. Is she even here?
Yeah.
Oh, she is? Oh, yeah.
Yeah.
All right. Yeah, okay, the worm thing is Morgellons.
Yeah, we had a couple good ones. Colin did get it right. He says alopecia, but also he said maybe it's ringworm. We had someone say fungus, seborrheic dermatitis. All
Yeah, it could be.
good.
Usually with seborrheic dermatitis, you'll see dandruff.
And of course,
He
Darren Parker
specifically said she didn't have any.
Darren Parker says probably just old scabby scalp.
There's
Old
old
scabby
scabby scalp
You
coming
got it,
down the
Darren.
hall.
You got it, brother.
Well, he had it bad, I'll tell you that.
You got the scabby scalp.
Yeah. He had the scours on his scalp. That's what we called it. All right. You ready to do podcast?
Yeah.
You want to just do the ending part first?
Sure.
All right. Let's see where we've got a good place we can. Okay, we could just stop right there. That's a good one. Let's do. You wanted to do, what was it that you said you wanted to do? Oh, Love Island. You want to talk about Love Island?
Yes.
Okay, yeah, let's talk about that. Okay, well, before we go, I know Tacey wanted to make an announcement.
I am now announcing that Love Island UK is now available for everyone to view on Hulu.
I got a text.
And it's going to be just as good this year as
Oh,
it
my
has been in the
goodness.
last year.
It is the greatest.
And it's not much of a commitment. I mean, there's only like 57, 58 episodes per season.
In the UK, they will play these shows every single night for what, 8 weeks? Something like that?
Yeah.
It's amazing. I learned so many things. I could recognize an Essex accent now, which, everybody just thinks that all the, a British accent is just what, who was that guy that, not Michael, well, like Michael Caine. Who's the guy that was in Notting Hill, that guy? Come on, Hugh Grant. Everyone thinks that British accent is Hugh Grant. There's a million different accents. And we can kind of pick out the Welsh accent now, too. As certainly if they say Cwtch, we know that they're Welsh.
Yeah.
Because they spell it CWTCH, which I love that. So I think that it is a great show. It's way more fun than the American one. They cuss like sailors. They call people the C word. They use the F word liberally. It is so much fun. The guys are hot and the girls are unbelievably hot. They're all 10s. And it's fun.
How funny.
Yeah.
I've never seen it.
You have not ever seen it.
No.
Well, you don't watch that kind of TV.
Well, you are missing out, my
But
friend.
as soon as I retire, that's the top of my list.
Well, it sounds like you retired from the show. Could you talk into
Yeah,
the
I'm sorry.
microphone? Thank you.
I was
No,
taking a
it's
nap. Hey,
Well,
soon
it's
as I
very
retire,
hot
I'm
in
like,
here, and it's
oh god, it's stifling. It's 4,000 degrees in here.
Feels good. Feels good. If you have
Oh, my
pulmonary fibrosis, it feels
right.
good.
If you're old and you have thin blood,
Yeah, that's what it
thin-
is.
Thin skin.
All right. Did we have anything else from there, from the chat room?
No, real.
We did more of those. Our next show is going to be a vacation show, and I have like a blue million
Yeah,
voicemails.
that's why I wanted to do these.
Yeah.
Yes,
Yeah.
we won't be live. Yeah, real quick. Let's see. Someone was asking about taking turmeric, and they're on warfarin. Now, I will tell you, turmeric
That's-
is also a bit of a blood thinner.
Yeah.
Yeah, so I'd be really cautious.
Okay. Well, we can look that
Yeah.
up.
And-
Turmeric.
And because you can't take NSAIDs.
And which blood thinner though? Is it Robon? Oh, geez.
Warfarin?
Is it Xarelto
No.
or one of those?
No, I think
Or
it's,
is it warfarin?
I think it's warfarin. Yep,
Is it warfarin though?
I think it is.
Because hardly anybody prescribes that anymore.
Pretty sure. Pretty sure. I'm scrolling back, but I'm pretty sure.
Okay.
Let's see. The lupus question.
This is fascinating.
I'm telling you,
oh my.
This
Are
is
we
going
still
great.
on?
Yes, we are.
goddamn
Okay.
100. It's in the heat, the hot.
Okay.
The heat.
Concurrent use of turmeric and hang on.
You know what? This is
You know what?
this is
It's all
worse
right, all
than
right.
waiting 45 minutes
Yes,
for a
okay.
hot
You're
chicken
right.
in Nashville
Well, you're not
last
broadcasting
weekend.
right now, but I want you to say that. Hang on.
Yes. Hang on.
I want to
We're
back
waiting.
it up.
Whew.
Well, okay. So concurrent use of turmeric containing natural health products with blood thinners may result in prolonged bleeding times and really should be avoided. So I would not take it with that.
No.
At least without talking it over with your prescriber, because different blood thinners have different targets, and there may be some where you could take it, but I'm not going to say that there are any. I would avoid it.
Agreed.
All right, particularly with warfarin.
Oh, it is so effing hot in here. It's worse
Well, just
than in Nashville this last weekend. I waited 45 minutes in line for hot chicken. For hot chicken
in 100-degree weather.
in 100-degree weather to eat it in an unair conditioned environment.
Oh no, now Hetty B's is air conditioned.
For like 20 seats,
Oh yeah.
and the outside porch is not.
Oh, you were outside.
Oh,
well, there
Lord.
was no.
Oh, my
Listen, I'm telling you.
That's too much.
God, it's so good though. It was worth it to me. I ate there with Carl, Vinny, and the cow photographer.
Did you have to wait?
No,
Well,
because
whatever.
they already waited, and I just came in,
Oh,
and they
you're
had
one
a
of
seat for
those.
me.
Mhm.
And but that's where I brought or Vinny that T-shirt, and he left it there. And then the next day, Vinny was on stage. He said, "Yeah, I left my T-shirt at the restaurant." And Shuley said, "I bet he didn't leave his leftovers there because Vinny's a big fat feller." But anyway, that was it was a fun place, but that was in the evening too, so it wasn't nearly as hot.
No, hot.
Could you not?
Blazing heat.
Yeah, and you got to eat it there because you could Grubhub it, but it won't be the same. Nashville hot chicken needs to be eaten in the Nashville hot chicken restaurant.
Yeah.
And so everybody can laugh at you when your face is melting off.
Oh.
Yeah.
Because I take one bite. I can eat that stuff, but the first bite, I will get laryngospasm. I'll start talking like this, and then the tears start flowing,
Oh, and the sweat. Like my ponytail was just dripping.
and then I'm fine
Like I'm all chafed on my thighs from walking around in the
from the
heat.
hot chicken.
And let me tell Broadway in
You're not
Nashville
supposed to stick it between
is
your
a
thighs.
nightmare. Have you been there?
Oh yeah, we were there not long ago. Yeah.
I mean, it is
Yeah.
insane.
Yeah, you weren't
Yeah.
here when we were talking about going to Kid Rock's place, and we went up to the 5th floor where they were playing alt music, and it was so loud. And
No, I'm
if
too old.
one person in that place had some virus, we were all going to get it, but nobody did, so it was fine. But it was wild.
Well, there was a karaoke bar in our hotel that was excellent. I would go there every.
Didn't they have
night.
Chuck E. Cheese? Like,
That
what
it
was
was
the
at
deal
the
with that?
Graduate Hotel, and there were Chuck E. Cheese like
The Graduate Hotel.
animatronics. Yes, it's based on
Mrs.
Dolly Parton.
Robinson, are you trying to
No,
seduce
it's
me?
based on. I don't understand it, but it's based on Dolly Parton. We had a big picture of Dolly over our bed.
Okay.
It was awesome. Anyway, yeah, it was great, but it's the hottest place in the whole effing world except for this room right here.
I know, but this feels good though.
No.
Well, let's get you out of here then.
Okay.
Hey, thanks always go
Thank you,
to
guys.
Dr. Scott and Tacey. Appreciate you guys being here, even though it's so uncomfortable in here.
It's really
We can't forget
uncomfortable.
Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould girl, Kim Chickens, Lewis Johnson, Patty Blue, Paul Ofcharsky, Sean Pedrick, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, the Ballet Bimbo, the Girl with the Genetic Half-Sister no one knows about, Percy Dumb, Roland Campos, Sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, Pat Duffy, Bill the Cop, Keith the Cop, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's voice double, guitarist Steve Tucci, the great Rob Bartlett, Adam Goldstein, Cowgirl Vic, thank you for your service, Cardiff Electric, Casey the Soil Scientist, Carl of the Talipes Equinovarus Carls, producer Chris,
I thought we weren't going to add to it.
a.k.a. Paducah Chris,
Okay.
the subreddit news chick, a.k.a. That Broad, Crows and the Bukkake Queen, Jenny Jingles, the inimitable Vincent Paulino, everybody, Eric Zane, Trucker Andy, Tucker and Anita Dixon, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, GVAC, Barry the Blade, and Todd Hillier, whose support of this show was always gracious and always appreciated. Listen to our SiriusXM show on Faction Talk Channel, SiriusXM Channel 103's, Saturday at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this... Okay. If I have pulmonary fibrosis, I'll only be able to do 3 lines, so then you'll be happy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. See, I can't stop when I get started, Tate.
You gotta quit. You gotta.
All right. I'll quit making jokes about it. Okay. See ya. All right. Now we gotta do. We're not done.
Gonna do intro.
Oh my God.
Yep. That's right. By God. And then we got another show to do.
I decided to sell my vacuum cleaner. It was just gathering dust. What do you call an ostrich in a cornfield? A crop duster. How many ninjas does it take to change a light bulb? Whoa, it's already been changed.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world famous Cardiff Electric Net. God damn it. Hang on. I can fix that. I don't know why that sounded so weird to me. Testing. Okay. Sorry. That's my fault. Okay, I can redo it from there.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Dr. Steve and my little pal, Dr. Scott, the traditional Chinese medical practitioner, gives me street cred. Wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. You have a question you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347.
Poohhead.
Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, whatever. So, thank you. Hello, Dr. Scott. Hello,
Hey.
Casey. Check out stuff.drsteve.com, stuff, stuff.drsteve.com for all your Amazon shopping needs. And check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And check out our Cameo, cameo.com/weirdmedicine. It's cheap. I'm cheaper than Shuli. And I'll say fluid to your mama or secretions to your daddy or whatever you want me to do. And I'll even do Cletus or Myrtle if you so ask. So check that out. I just do it for fun. We're going to be on vacation, so I'll be doing it from the beach some. And that might be somewhat interesting. I don't know. Probably not. Probably still suck. And then patreon.com/weirdmedicine. Tacey and I do a show there that's a little different. Well, it's a lot different. And over the next couple of weeks on there, I'm going to be posting the first appearance of myself on the Opie and Anthony show and a couple other things, other old gems like that. Well, I had no idea I was even going to be on that show. And they just sort of sprung it on me. So that was kind of fun. And then we're still doing the exam room. We haven't had any celebrities in a while. But I've just been giving them a break.
Well,
but we're
they're
gonna
just
be doing
hard
that.
to pin down. I mean, they say they're going to do it, and then you can't.
Yeah, we've had a couple of them flake
Just
out. Well,
wake up in time, or
yeah, at 1 in the afternoon.
Yeah.
We're unimportant, and we get that, but it is fun. We've got a bunch of friends that owe us a favor or two and can give us 15, 30 minutes and ask us medical questions, which they're going to do anyway. So it's kind of a fun thing. Scott, you should come in on one of those.
Yeah, I'd like to.
Yeah,
That'd
they're
be cool.
fun. All right. Okay. That'll do on that, right? Oh, no, wait. So I did want to throw, somebody on Reddit had a funny thing that, Cardiff Electric, nobody knows who he is. Mm-hmm. And so recently Cardiff has been taking my voice and putting it on these different game shows that he does, and he modulates my voice the same as his. So people are thinking, well, maybe Dr. Steve is Cardiff Electric, but our voices are different. And this guy on, it's hilarious, on the subreddit said, nope, it's not Dr. Steve, it's Dr. Scott. They get all hepped up on Dr. Scott's CBD nose spray, and then Steve's paying Scott to do it. And actually, your voice sounds more like Cardiff Electric's than mine does. So that one's kind of plausible. All will be revealed September 17th in Rochester.
Oh.
When I will be there and Cardiff Electric will be there. And if we're in the same room at the same time, well, it's probably unlikely that it's me. So that's all I'm saying. And if you don't know what we're talking about, that's fine too. It was literally less than 1 minute of the show. So, but
Cool.
it was funny because he said, well, I was in his chat room and there's only 8 people in there and they're probably all boomers. That's true. There are quite a few boomers in there. I know Richard Kish is a boomer. I don't know about any of the other folks. I know that Amanda Swan is not a boomer. Kim Chickens is not a boomer. I'm assuming Patty is not. But we have our share of boomers. But this is not a video show. We do an audio podcast, but we have this video element for the handful of people that want to hang out with us. And Scott and I have both said it's changed the dynamic of the show, that we have more energy if we know we're actually talking to somebody.
Yes, with great questions and interactions.
Yeah, no, it's great. And they have
Way
fun
more
in there.
fun,
And
way more fun.
And if somebody gets laid from meeting somebody in our chat room, I want to know about it.
There you go.
I want to
Who's
know about
first?
it. Yeah, that's right. All right, very good. Thank you. And well, let's move on to the show. All right, there you go. Now we're done.
Now we're done.
So we're gonna do another show tomorrow. You're cool with that?
3:30.
Yep.
Tree turdy.
Tooth hurdy. That's the best time to go to the dentist, don't you know?
Don't you know?
Tooth hurdy.
Tooth turdy.
But Myrtle always goes, well, I always hear it was right before closing time because the waiting room wasn't so busy.
I'm the same.
She doesn't understand humor. That Myrtle doesn't.
No, she's got no skills. Hey, we'll see you in a minute.
Cletus will always explain the joke that's so obvious. They're always dad jokes, and he explains them. But then, what was the one about bread? why does why does a baker make the best kind of thief there? Well, it's because they need the dough. Don't you know? Well, because, a baker, they make bread, they make dough, but also dough means money in some circles, don't you know? He'll always explain it. And then Myrtle will just get it wrong. She'll say, well, why is a baker the best kind of thief? Well, because well, they could probably pick your pocket or something, if you come in there to buy something, you ain't looking. She's just an idiot. So, all right. You want to play a song?
Yeah, let's do one.
What do you want to play?
I was just thinking.
We could turn the
AC
fan
on.
on. Yeah. Hang on. Let me do that. What were you thinking?
I was thinking a little Ramblin' Fever from Merle Haggard.
Oh, do I know that?
Oh, yeah.
Do I?
It's country.
Oh, okay.
It's a country walk.
Country song, so I know it.
Oh, yeah. My hat don't hang on the same nail too long. My ears can't stand hear the same old song. And I can't leave the highway long enough. I bogged down in the mud.
I hate that Casey's camera didn't work today. I didn't check. We were in such a hurry today.
I don't know if it's not plugged.
No,
in.
it got unplugged and then I plugged it back in. I have to reassign it. Oh,
Music.
Crap. Should we play everybody the song we did for Love It? I could play that. I'll just play a little bit of it as a teaser.
Yeah, play the middle of it. The first, it starts off a little slow, but the middle of it's good.
Yeah, I mean, we're terrible.
Well, no, we're not terrible. We're not good.
Right. Yeah. Fair enough. That's right.
Oh, thank God, Dr. Steve turned the fan on. Okay, guys, we're feeling better now.
Waiting for the dice to roll. Sitting here in limbo.
Jimmy Cliff would be rolling over in his grave if he
Time to search my soul. Well, they're putting up resistance, and I know my fate will lead me on.
All right. So anyway, if you want to hear the rest of that, you got to sign up for Patreon. That's some inducement right there.
That's some kind of way to sell it, buddy. It's better than what we usually do, which is.
Well, it was fun doing it.
It was a lot of fun.
Getting back in the studio, the music studio's next door to the Weird Medicine studio, and we need to do more of that.
Yeah, it really was a lot of fun.
Just make sure I'm tuned up.
Oh, Kush is still out there. Kush?
Hindu Kush.
Hindu Kush. Hope you're doing all right. Love it.
All right, what do you want to do?
I'm in. Hat don't hang on the same nail too long. It's GCD, and it's just a normal walking.
Okay.
Pretty much, there's the whole way through.
All right.
If I can find it. My hat don't. My hat don't hang on the same nail too long. My ears can't stand to hear the same old song. And I can't leave that highway long enough, bogged down in the mud. I've got rambling fever in my blood.
Okay, I got it.
Yep,
I got it.
Yeah, I knew you got it.
Okay, you need a little more of this.
Yeah, reverb.
There you go.
Yeah, we're Amanda Swan, swimming pools and movie stars. That's us. We'll be heading out to the concrete pond here in a minute. My hat don't hang on the same nail too long. My ears can't stand to hear the same old song. And I don't leave the highway long enough to get bogged down in the mud. 'Cause I've got rambling fever in my blood.
Okay, yeah. Okay. Now, wait, does it modulate at all? Does it just stay on the G for that long and then go to the D?
Yep.
That's it? Okay.
And it's like almost 8 bars. And
Yeah,
it's
yeah. Of just the G.
Just
Okay.
2 Ds and then a G, yep.
Okay, I thought I had it, but I didn't quite have it. Okay, now I got it.
So that little lead in, just play it lead in again, you hit it, was perfect.
Okay.
Just, noodling in it. My hat don't hang on the same nail too long. My ears can't stand to hear that same old song. And I don't leave the highway long enough to get bogged down in the mud. 'Cause I've got rambling fever in my blood. Caught this rambling fever long ago, when I first heard a lonesome whistle blow. If someone said I ever gave a damn sure told you wrong. I've had rambling fever all along. Rambling fever, the kind that can't be measured by degree. Rambling fever, I ain't no kind of cure for my disease. There's time.
So that one time it doesn't go to the D.
Yeah. No, well, just for the 2 beats.
What?
See, there ain't no kind of cure for my disease. Yep.
No, so the chorus is different than the verse then.
Oh yeah, with that one D. Yeah, you're right. Yeah.
Okay, so let's do the chorus then.
So let's go back to the chorus, and now we'll tell you the bridge there.
Oh.
It starts out on the D. Yeah. There's times I like to go to bed, lay down my sofa.
Wait, what is this?
And let some pretty lady rub my back. We'll skip that part.
No.
It's just the bridge. It's a little bridge from.
Oh, okay, I get it. It's a bridge, but how does it go?
There's times I'd like to lay in bed down on a sofa, back to just a GC, and let some pretty lady rub my back. And spend early morning drinking coffee and talking about when I'll be coming back. There you go. Rambling fever, the kind that I can't measure by degree. Rambling fever, ain't no kind of cure for my disease. There's times I'd like to go to bed so far, C, B, and G. Let some pretty lady rub my back.
Wait, now it's another different thing?
No, it's just I don't know why they put that down either. Just play it just straight. Just play it just straight. GCD. Just exactly like the first pieces. That bridge, whoever
the
typed
bridge
this
is
in,
fine.
It's just weird. They typed it in there weird. We'll play it straight.
Yeah, well
Trust me. We'll just play it right straight through. Because
I don't know what that means.
Well, we'll just play it. Just go back to the first one. Let's go back to the very top of the song and play it straight through. Just follow me.
Okay.
You play it. 3, 2, 1, and lead us in there.
Oh, okay.
Dr. Steve. my. Hey, you had it.
That's no, that's not how we played it before. Okay, you were doing the chorus, and I was doing the verse. Because the verse, you stay on the G twice as long.
Okay, gotcha.
Right?
Yep. I'll just let you play it. I'll just.
No. I want to play it right, but just start singing when I do the.
Gotcha. Love it. I'm working on it, honey. I know it.
You ready?
Yep. Slightly. My hat don't hang on the same nail too long. My ears can't stand to hear the same old song. And I don't leave the highway long enough to get bogged down in the mud. I've got rambling fever in my blood. Got this rambling fever long ago, when I first heard that lonesome whistle blow. If I heard someone say I gave a damn, well, damn, she told you wrong. I had rambling fever all along. Rambling fever, and it can't be measured by degrees. Rambling fever, ain't no kind of cure for my disease. There's times I like to spend in bed on a sofa and let some pretty lady rub my back. Spend the early morning drinking coffee and talking about when I'd be coming back. Rambling fever, can't be measured by degrees. Rambling fever,
do the bridge again.
Ain't no kind of cure for my disease. There's times I like to lay in bed and a sofa and let some pretty lady rub my back. Spend early morning drinking coffee, talking about when I'll be coming back. Rambling fever, kinda can't be measured by degrees. Rambling fever, ain't no kind of cure for my disease. 'Cause I don't let no woman tie me down. I'll never get too old to get around like Dr. Steve. I'm gonna die along the highway and rot away like some old-fashioned pole. Rest this rambling fever in my soul. Rambling fever, kinda can't be measured by degrees. Rambling fever, ain't no kind of cure for my disease. Rambling fever, kinda can't be measured by degrees. Rambling fever, ain't no kind of cure for my disease.
I still don't get that bridge part. It didn't sound right when we did it.
It didn't, but I really do think
just play
it
straight.
Yeah, I think just play it straight because the way that it typed in, it just doesn't make sense at all.
Okay.
It's just weird.
Okay, yeah.
So yeah, it's fun.
Yeah, that's a good one. We could actually do that one.
Yeah, I think it's not bad. I wonder how many glasses of wine it would take for Tasty to get back on vocals. A lot, Sean. I don't think there's enough. Oh, Ramble on Rose. Hey, we did Ramble on Rose last time, didn't we?
What is Ramble on Rose?
Oh, that's the one we did. Ken, might be the Ken.
I expect it goes Ramble on Rose at some point.
That's right. Did you say your name was Ramblin' Rose? Ramble on, baby. We did a couple
I believe you.
Yeah.
No recollection of it. How's it go?
You have the good thing about you is you forget what we do pretty quickly, so it doesn't.
Everything's new.
It doesn't jade you.
It's always everything's brand new.
Everything to you just seems like it's just as bad as the first time. It was we did Ramble. So with that one day we did the Rumble thing.
Okay.
Kush said we instead of we should do Ramble on Rose for the Rumble thing. And we did it.
What about
it was fun.
Wagon Wheel?
Oh shit! I can do Wagon Wheel. Do you know Wagon Wheel?
Yeah, I know it. It's 4 chords over and over and over again. I'll just play them once and then hit the looper.
Hang on. That's hilarious. Let's see.
We could do that one time.
What's that?
Where I could hit the looper and then I could play a different instrument.
Yeah.
Songs like that are just over.
Oh God, we played this a long time ago, didn't we?
Yep. Let's see if we can get a drum pattern going. Let's see. Can't remember how to clear the damn thing. I just got this thing. Can you sing it though without?
Yeah, I think so. Yeah. Okay. Heading down to the line of the pines, thumbing my way down to North Carolina, staring up the road. I pray to God I see headlights. I made it down the coast in 17 hours. Picking up a bouquet of dogwood and flowers, and I'm hoping for Raleigh I can see my baby tonight. So rock me, mama, like a wagon wheel. Rock me, mama, any way you feel. Hey, mama, rock me. Yeah, I think we do. I mean, it won't sound good, but it'll be fun. We need Kim Chickens in here singing. I do have a banjo, Amanda. Don't tempt me.
Yeah.
I do have a banjo. I do have a banjo. I'm not afraid to pick it.
I don't know why I can't get any volume out of this. What's going on?
What number you plugged into?
Hang on. I think this thing is.
Uh-oh.
Oh, wait a minute. Oh.
Well, that made a difference. Something ain't right.
Oh, that's why I'm having trouble.
It's loosey goosey. Uh-oh. I'm not sure.
Hang on.
Now we're jamming. No, we can't. That's going to be hard.
No, I can do the tempo any way you want. Give me the tempo you want for Wagon Wheel.
Yeah, I think Lovett's into a little bit of Wagon Wheel. All right. 3, 2, and...
Can you hear that?
Yeah. Let's stick with the bass and mandolin for now. Uh-oh. It does thump. I know, Colin.
What?
Colin says, man, that thing thumps. So it does.
See if you can do it to that. You keep us on. What are the chords?
G, D, E minor, C.
Okay.
Well, no variations. Even if I play a variation, if I play it, that means I'm playing it the wrong note. All right, boys and girls, ladies and gentlemen, prepare to be disappointed. Heading down land of the pines, on my way to North Carolina. That's terrible. It sounds like a rapper.
It's all right. Just do it.
Heading down to the land of the pines, thumbing my way to North Carolina, staring at the road. I see headlights. Made it down the coast in 17 hours, picking up a bouquet of dogwood flowers, and I'm hoping to ride it and see my baby tonight. Rock me, mama, like a wagon wheel. Rock me, mama, any way you feel. Hey, mama, rock me. Rock me, mama, like the wind and the rain. Rock me, mama, like a southbound train. Hey, mama, rock me. Running up the cold in New England, I was born as a fiddle on an old-time string. But my baby plays the guitar, I picked a banjo now. That's terrible. Oh, North Country winters keep getting me down. Lost my money playing poker, so I had to leave town. Ain't turning back, living that old life no more. So rock me, mama, like a wagon wheel. Rock me, mama, any way you feel. Hey, mama, rock me. Rock me, mama, like the wind and the rain. Rock me, mama, like a southbound train. Hey, mama, rock me. Walking through the south of Roanoke, caught a trucker at a field. They had a nice long tour, but he's heading west to the Cumberland Gap, to Johnson City, Tennessee. Gotta run on the sun before the sun. I hear my baby calling my name, and I know that she's the only one. And if I die in Raleigh, at least I will die free. So rock me, mama, like a wagon wheel. Rock me, mama, any way you feel. Hey, mama, rock me. Rock me, mama, like the wind and the rain. Rock me, mama, like a southern train. Hey, mama, rock me. Rock me, mama, like the wagon wheel. Rock me, mama, any way mama, like the wind and the rain. Rock me, mama, like a southbound train. Oh, it's awful.
So let me ask you something.
Yeah.
So it goes G, G, D, E minor, C, but then it goes G, D, C, doesn't it?
Yep.
Okay, we weren't playing it that way in the beginning. At least I wasn't. And then sometimes we were doing it, and sometimes we weren't. So it's every single time it's G.
Yep.
Right?
Yep. So what effectively be is if you think of it in two lines, the first line,
Yeah.
G, D, E minor, C, the second line, G, D, C, and it's like that the whole way through.
Okay. All right. Well, that's not the worst song.
That's the worst.
I fuck up every song we play. So. All right. Thank you, everybody. Now, we'll probably be back tomorrow. We don't expect anybody to actually show up for that, but you're
I've already
welcome.
passed out the word there. And some of them are coming back.
Really?
Yeah, I just took because we won't be on here live next week.
Well, let's think of something we can play that would actually be good for next time. Now that I figured this stupid, I thought I had a bad unit, and I figured out what's wrong is my cable is incorrect. I think this thing has a mono output. That's what I didn't know that, so we got a stereo cable for it.
Oh, okay.
That's what the problem is. So if I just short those two things internally, it gets, I've been messing with this thing. I almost sent it back.
Well,
Anyway.
It's a good thing you're the expert. All right, boys and girls, ladies and gentlemen, we're shooting for 3:30 tomorrow.
Yep.
Amanda will see you. I'll bring my banjo. Sean will see you tomorrow. KC, hope to see you. Colin, see you, buddy. Thank you. We'll see you tomorrow. Hey, great questions today, guys. Thank you so much. If you come up with anything else, please share them with us. Tell your friends. Come up with some good questions too. Love it. All right, she'll be here too. Cool. We'll have our family intact. Good thing. Oh.
All right.
And we'll try to come up with a song we can actually not butcher. Y'all have a good day. See you
Well,
tomorrow.
It's not you, it's me. I'm just gotten really shitty. All right. Thanks, everybody. Thanks for you guys are crazy to hang out this long, but we appreciate it. It's way more fun than it should be.
Way more fun.
For us.
Yeah, buddy.
All right. We'll see you.
All right. We're out.